So without further ado, I would now like to hand you over to our MC for the evening, Mr. George Hook.
This is great crack, first of all, right? Only if you make it work, because we're not going to let you know you have comfortable seats. You have the best seats ever in the Bluebird Care series of lectures. What is your advice to people here about security in the home?
Do the basics and do it well. Install alarm, the aspect of your house. Don't have big hedges around your house because that protects the people trying to break in. When you're leaving your house, put your alarm on. It is useless, absolutely useless, having the best alarm in the world and not using it.
There's still a lot of lack of security in rural parts of Ireland anyway.
Community love groups over the last 30 years have probably installed somewhere in the region of 3/4 of all the social monitored alarms that exist in the country. Those have saved not just countless hours of agony, but many, many lives as well.
My name's Anya. I just wanted to ask about the personal alarm at home. Is it that you have to have a home phone and pay the rental for the 12 months of the year and pay a small fee for the personal alarm as well?
The general cost of monitoring is running between about 65 to 90 euros. And per year.
Per year.
They'll be responded to within about 40 seconds. If necessary, they'll be in a position to make 3 phone calls simultaneously to the 3 different key holders of the house.
One thing that's been scientifically proven is being socially involved and socially active, not being isolated, narrows down, it cuts down on your risk factors for diseases like dementia and Alzheimer's. So getting involved, staying socially active, keeping up your friendships and relationships is incredibly important. That what we provide is the opportunity for people to do that. And it's incredibly important that this happens in retirement, because I'm not sure if you're aware, George, and perhaps you should be with your retirement looming recently announced. The first year after retirement, you're between 4 and 7 times more likely to have a fatal heart attack or stroke.
I mean, I would suggest to you that your mind isn't all that different from when you were 24 or 25. Just as active, just active in a slightly different way.
In Kerry, we don't call them senior citizens, we call them recycled teenagers.
And saw so many people of my own generation in isolation, feeling sorry for themselves and not getting out. There's a lot more people out walking, that's around Kerry and Cork since I started doing it.
And we looked at a lot of housing estates in the Midlands, and we simply couldn't look at taking them over, because I suppose they're built in the boomtime, George, and they're built without the adequate services. And the whole thing about Respond is where all of our communities are, it has to be close to shops, restaurants, a church, whatever. We have to make sure that there are services in place, particularly with older people where there mightn't be transport available.
We used to be a caring society, and we used to prioritise, different things from what we do now. When the country was far poorer, we could provide rural police stations, postal collections twice a day, free education, and a whole raft of things. For example, I remember as a child, the country was poor, but every year, governments of whatever stripe had a public housing programme. Public housing was built every year by county councils or corporations in cities.
We know that the government is currently reviewing the free travel scheme, and we will be campaigning starting next month very, very vigorously to oppose any changes or any cuts to the free travel scheme. They're looking at 3 things. One, they're looking at charging, be a real Irish free travel scheme, charging for the free travel pass. 2, restricting the hours again. Up to a number of years ago, the hours you could use the free travel pass were restricted to off-peak hours. Or 3, restricting the form of travel that you can use with the free travel pass.
I have no public transport. I live in the country. The bus doesn't pass the door.
Right.
And I can only use the train if I have a car.
So we're going to give medical cards to, if I did have, to my 6-year-old, under 6 grandchildren who don't need free medical care because A, they're healthy, and B, their parents can afford it. This whole idea in Ireland is wrong, that everybody should get free travel. I shouldn't get free travel.
But certainly whatever about the current generation of older people, and certainly the current generation of older people are far better off than our previous generations. But and I've heard George Lee refer to it, that this might be the golden generation. I think certainly future generations of older people, it's going to be different. It has to be different. but I don't think it has to be drastic. The only way it's drastic, and those kind of comments that we can't afford the older people, what are we going to do? We're going to hell in a handcart because of all the older people. That's the kind of thinking of people who stick their head in the sand and say, we're going to do nothing about it. If we do nothing about it, in 20 years' time, then we're going to have a problem.
We've already heard of them. Bluebird Care, Eddie is going to close it off.
Eamon mentioned planning, and he's so right. There's no planning in this country. We plan for 5 years. We plan from the day they get elected until the day they finish their term. That's what the plan is, and it's so wrong. We should be planning 20, 30 years ahead. And finally, to Uncle George here. George, we've done 7 of these events now, and it really has been fantastic. The debate has always been superb, and the reason for that is Uncle George, even though he was a few minutes late tonight.
Well, all the topics that we're talking about, very interesting. Very interesting.
Last one on that. That's good.
It's great to see the issues that are facing the elderly and be from a rural part of the community. I think it's very important, these kind of things, and I was very interested in what George was saying.